Millions of Americans rely on antidepressants to manage conditions ranging from depression and anxiety to post-traumatic stress disorder. These medications, which have been used for decades and undergone rigorous testing, are now facing new scrutiny under the Trump administration. Citing concerns over chronic disease, including in children, the administration has pledged to assess the prevalence of and threat posed by certain commonly prescribed medications. The Make America Healthy Again Commission is set to review a broad range of existing drugs, including selective serotonin reuptake inhibitors, SSRIs. U.S. Health and Human Services Secretary Robert F. Kennedy Jr. has long expressed skepticism about the safety of antidepressants and other psychiatric medications, making misleading and unsubstantiated claims. During his January confirmation hearings, he controversially compared taking SSRIs to heroin addiction and suggested, without evidence, that these drugs might play a role in school shootings. Such rhetoric implies that antidepressants are dangerous, says Lisa Fortuna, chair of the American Psychiatric Association's Council on Children, Adolescents, and Their Families. Statements like these could discourage people from seeking necessary treatment and exacerbate the stigma surrounding mental health conditions. SSRIs, while not a one-size-fits-all solution, have a strong scientific track record supporting their efficacy. They can be highly beneficial for many individuals, including children and adolescents, according to Fortuna, who is also a psychiatrist at the University of California, Riverside School of Medicine. Science News consulted Fortuna and two other psychiatrists to explore the evidence behind SSRIs, their benefits, potential risks, and the impact of political rhetoric on mental health care. The many uses of selective serotonin reuptake inhibitors Zoloft, Prozac, and Celexa are among the most well-known SSRI antidepressants. Despite their classification as antidepressants, they are prescribed for a variety of conditions, including anxiety, obsessive-compulsive disorder, and eating disorders, according to psychiatrist Awais Aftab of Case Western Reserve University. Numerous clinical trials indicate that SSRIs generally outperform placebos across multiple conditions. However, like all medications, their effectiveness varies. For depression, for instance, about half of patients respond well to one or more antidepressants, while others experience minimal improvement or no benefit at all. SSRIs are used to treat conditions such as depression, anxiety, bulimia, obsessive-compulsive disorder, post-traumatic stress disorder, binge eating disorder, rheumatoid arthritis, premature ejaculation. Although SSRIs often take weeks to take effect, they can significantly improve mood, sleep, and anxiety levels. A review of 37 clinical trials by psychiatrist Giuseppe Guaiana and his team at Western University in Canada confirmed that SSRIs are more effective than placebo treatments for generalized anxiety disorder. However, the decision to prescribe SSRIs must be carefully considered based on individual needs. The reality of SSRI side effects: before the advent of SSRIs, tricyclic antidepressants were widely used but came with significant risks, including sudden drops in blood pressure and other cardiac issues. SSRIs marked a major improvement in safety and tolerability, but they are not without side effects. Common side effects of SSRIs include upset stomach, headaches, reduced sexual desire. The impact on sexual health is notable, with estimates suggesting that 25% to 70% of users may experience issues like decreased libido. Given that over 8 million Americans were prescribed sertraline, Zoloft, in 2022, these side effects are a key consideration in treatment decisions. Fortunately, multiple SSRI options exist, allowing doctors to adjust dosages or switch medications to minimize adverse effects. This process of balancing benefits and risks is a standard approach in medicine, much like determining the appropriate use of aspirin for different patients. Debunking the myth of SSRI addiction. Addiction involves cravings, compulsive drug-seeking behavior, and withdrawal symptoms when the drug is unavailable. SSRIs do not produce a euphoric high, nor do they lead to the compulsive behaviors associated with addiction to substances like heroin or cocaine. However, stopping SSRIs abruptly can cause withdrawal symptoms, including anxiety, irritability, dizziness, nausea, brain zaps, electric shock-like sensations. These symptoms, while uncomfortable, are not indicative of addiction. A 2024 study in The Lancet Psychiatry estimated that withdrawal symptoms occur in about 15% of individuals who discontinue SSRIs. Importantly, treating mental illnesses like depression and anxiety with SSRIs may actually reduce the risk of developing substance use disorders. Addressing the mental health crisis among young people. Mental illness is a pressing issue among American youth. In 2023, more than half of high school girls and over a quarter of boys reported experiencing prolonged feelings of sadness or hopelessness. Psychiatrists emphasize that SSRIs are just one tool in a comprehensive mental health treatment plan. Therapy, family support, and educational interventions all play essential roles. Despite an increase in adolescent antidepressant prescriptions, rising from 4.6 million in 2016 to 6.8 million in 2022, Fortuna stresses that medication is not the sole solution. SSRIs carry a black box warning about potential links to suicidal thoughts in young people. However, untreated depression is also a known risk factor for suicide. Therefore, careful monitoring and a nuanced approach to treatment are critical. The persistent stigma around mental health treatment. Despite growing awareness, mental health stigma remains pervasive. Depression is often dismissed as a condition that can be overcome through sheer willpower, and psychiatric medications are frequently misunderstood. Some still believe that SSRIs create artificial happiness or fundamentally change a person's identity. Aftab notes that while many people are now comfortable using antidepressants, a significant portion of the population still holds stigmatizing attitudes. Fortuna warns that recent political rhetoric could discourage parents from seeking necessary treatment for their children, reinforcing the misconception that taking medication is a sign of weakness. Unanswered questions about SSRIs. Although SSRIs have been available since the late 1980s, researchers continue to explore fundamental questions about how they work. Key areas of uncertainty include why SSRIs take weeks or months to become effective, their long-term effects, particularly after years of use, the nature and frequency of withdrawal symptoms, how they perform in individuals with multiple mental health conditions. While these uncertainties persist, what remains clear is that SSRIs are essential medications for many people. Oversimplifying their effectiveness, either by overstating their benefits or demonizing their use, is not helpful. A balanced, evidence-based perspective is necessary to ensure that those who need these medications can access them without fear or stigma.